Okay, so we're going to talk about the knee exam today. So evaluating the knee, first thing that we usually like to do is check for range of motion. Okay, so what I ask the patient to do is bend your knees back as far back as you can, keeping your feet on the table. Okay, good. And as we can see, this is normal range of motion. Okay, and then do extension. Okay, and this is normal extension here. There's a couple ways that we can evaluate for looking for ballottement or swelling. Okay, one way that we can do that, okay, is we can milk the fluid into the knee joint, and then we can palpate the patella and see if it moves in space or not. Okay, as we can see here, I don't see any intra-articular effusion. Okay, another maneuver that we are able to do, okay, is that we can actually try to milk fluid into the joint, okay, and laterally here we can just push and see if fluid comes. Positive would be if there's some ballooning in this area. Okay, so we milk fluid back into the joint. Okay, I'm just underneath the patella, see if I can push fluid out, and you see a ballooning. As you can see, he doesn't have any. Okay, moving on to some further tests here. So Lachman's test, evaluation for ACL. Okay, knee flexed to 30 degrees, one hand on the femur, which doesn't move, other hand on the tibia. Okay, anterior translation of tibia on femur. Okay, again, this hand doesn't move. My other hand is doing all of the motion. Okay, anterior translation, and he's got a great endpoint. Okay, positive tests would be if there was laxity, and a lot of times you have to compare to both sides. Okay, evaluating for medial collateral ligament, the way I like to do it is I like to have the patient bring their knee off of the table here. Okay, and I'm looking for valgus stress, one hand laterally here, other hand down here. Okay, bend knee to 30 degrees. Okay, and I'm providing a valgus stress just right here at the medial collateral ligament. Okay, and this provides good restraint for me. Again, we're looking for two things: pain at the medial collateral ligament and laxity. Okay, we can do the opposite when we do varus stress. Hand right here, knee flexed to 30 degrees. Okay, varus stress. And again, we're looking for pain at the lateral collateral ligament or laxity. And at 90 degrees here, we can do a lot of good exam maneuvers. What I'll do is I'll have myself sit on his foot, okay? And right here, I can palpate a lot of different landmarks. Inferior patella, looking for Sinding-Larsen-Johansson syndrome in pediatrics. You can also palpate the patellar tendon, okay? We can also palpate the tibial tuberosity for Osgood-Schlatter's disease. We can palpate the joint line right here, looking for medial meniscus injury. Okay, we can also palpate the lateral joint line here. Okay, this is a good time to do the anterior and the posterior drawer. So right here at 90 degrees, anterior drawer, anterior translation of tibia on the femur. Okay, or posterior drawer, posterior translation of tibia on the femur. Okay, so those are some tests for the ACL and the PCL in here. Moving on to the McMurray's. With the McMurray's, we have our fingers on the joint line. Okay, so I have my middle finger on the medial joint line. I have my thumb over here on the lateral joint line. Okay, knee to full flexion. Okay, external rotation and extension is for evaluation of the medial meniscus. Okay, internal rotation and extension, lateral meniscus. Okay, so just one more time: full flexion, external rotation into flexion with pain at the medial meniscus, or a clicking is positive for McMurray's on the medial side. For medial meniscus, full flexion, internal rotation, okay, lateral meniscus in here. Another meniscus test that we can do is called the bounce home. This is a passive hyperextension of the knee. So bounce home like this, okay? And a positive test is if the patient complains of pain at the joint lines in these areas, right in here. Okay, what I like to do as far as patellofemoral exam maneuvers, I like to palpate around the patellar facets to see if there's any pain or tenderness in these areas, right here. Okay, we can do the apprehension test, and that's where we laterally deviate the patella, and a positive test would be an apprehension sign from the patient. for patellar subluxation or dislocation. Okay, patellar grind is where we grind the kneecap into the femur, okay, and that's where, if they complain of pain, that can give us an idea of patellofemoral pathology on the posterior surface of the patella. Okay, and the last test we'll do is we'll have our patient go onto his side. Okay, and we're going to do the Ober's test. Okay, and I'll have you just slide over to the side here. There we go. Okay, and so we're going to evaluate the right side. Okay, and what we're doing here with this is hyperextending the hip slightly with abduction. Okay, and we ask the patient to bring the knee, let the knee fall into the hand. Okay, and then fall into the table. Okay, and this is slightly positive. Right here. This should hit the table here, but this would be a positive. There we go. I think we got it down there. So that's a normal exam. If it was staying up here like this and we could not get it down, that would be a positive Ober sign for IT band tightness. And that is the knee exam. Thank you very much.